Good evening, everyone, and welcome to Representative Chrissy Houlihan's Telephone Town Hall focused on our senior community in Pennsylvania's 6th District. Before we get started, I wanted to let everyone know that if at any point during this call you have a question for Chrissy or one of our expert panelists, please press *3 on your phone. Again, at any point if you have a question, please press *3. That will direct you to a member of Chrissy's staff who will take down your question and enter you into the queue. So again, that's *3. I also wanted to take a moment to remind everybody on the line that today in Pennsylvania is a primary election. Everybody should go out and exercise their constitutional right to vote. So if you are worried about missing the town hall, fear not. We will be sending around a recording of this event as well. So please go out and vote if you haven't yet. Again, polls are open till 8 p.m. With that, we'll get started. If you have questions, press *3, and I'm going to hand it over to Chrissy.
Good evening, everyone, and thank you, Connor, and thanks very much for joining our telephone town hall tonight. Today's town hall will be focused on our seniors. These past 15 months have certainly been extremely difficult, and that couldn't be more true for our senior citizens. About 80% of the Americans who were killed by this virus were 65 years or older, and many older Pennsylvanians have lost friends in senior living communities, including in nursing homes. What's more is that the impact isn't just simply physical. Mental health issues have also skyrocketed amongst our seniors. Early studies have already demonstrated an increase in anxiety and depression for our elderly community, which has been understandably in some of the strictest lockdowns. Grandparents have gone over a year without seeing their grandchildren, and children were scared to visit their parents for fear of exposing them. In our office, we heard from countless seniors who have needed help. Since the start of this pandemic, this office has been leading on issues affecting our seniors: safety in nursing homes, access to mental health services, PPE supplies, and much more. We have come a long way since March. Just this afternoon, President Biden spoke to the newly issued CDC guidance regarding mask wearing. So if you're fully vaccinated, meaning you are 2 weeks after your final shot, you can resume most normal activities without wearing a mask, except for where required by federal, state, or local, or tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. Here in Pennsylvania, Governor Wolf made it clear that for unvaccinated peer people, the mask mandate will still stay in place until we hit that 70% immunity threshold. This is great news as we collectively work to return to normal, to rebuild our economy, to be safely with our loved ones, regardless of our age. And I hope I'm right when I say that the worst of this virus is behind us. And I know that we certainly have a long way to go, though, which brings us to our topic today. Recently, I helped pass the American Rescue Plan, a comprehensive bill that has been instrumental in getting nearly 50% of Pennsylvanians 18 or older fully vaccinated. In our community, over 70% of our seniors have been fully vaccinated. I also fought to make sure that specific provisions were secured in the American Rescue Plan that will support our senior community, and here are some of those provisions. Increasing federal matching funds for Medicaid to help seniors get home and community-based services. Expanding marketplace premium assistance so that no adult under 65 with moderate income will pay more than 8.5% of their income. Securing $50 million for community-based funding for local behavioral health needs, including mental health issues like anxiety and depression. Providing $250 million for states to deploy strike teams to nursing homes with COVID-19 cases. Investing $1.43 billion into Older Americans Act programs, including $750 million for nutrition services like home-delivered meals, $460 million in services to address social isolation and increase vaccination outreach, and $145 million for caregiver counseling, respite care programs, and other programs through the National Family Caregiver Support Program. With so much going on, I very much wanted to take the opportunity to today have this town hall to talk about the benefits that we've passed for our seniors in Pennsylvania with our local leaders. And on today's call, we have Carol Harkins, the Supervisor of Chester County Aging Care Management, Katie Katchmark, the Deputy Director of the Berks County Area Agency on Aging, and Meg Sneed, the Acting Secretary of the Pennsylvania Department of Human Services. Each of these women have provided invaluable leadership during this crisis, and I'm very grateful to have them on the line with us this evening. We'll be able to hear from each one of them before we transition to questions and answers. And remember, if you have one, please press *3. Also, remember, if we're not able to get to your call, a member of my team will answer your question within 48 hours of this town hall. Please remember that there will be thousands of people on this line, and we will try to get to as many questions as we can. But if at any point, again, please press *3 if you have a question. And with that, I'd like to hand it over to Carol for her opening remarks.
Yes, good evening. Thank you so much, Congresswoman Houlihan. We really look forward to all of these wonderful things you're talking about, which will actually be made available to the area agencies on aging through our funding in fiscal year 2021-22. But we have provided many updated and increased services to seniors through the CARES Act and the FFCR Act already during this pandemic time. We have had a very difficult time being able to support our providers. They have had a difficult time maintaining their employees. We have been able to give a temporary increase in the amount of money that we are paying them in order to support our providers and therefore make sure that our seniors are provided services. We have also used some of this funding to increase senior center services, although we know that unfortunately they've not been open. We are supporting the community in many ways, including virtual programs, being able to help people by appointment, and also most especially being able to provide food for seniors, which is so critical to make sure that they have what they need. We've also used that funding for home-delivered meals and also to provide additional home services. The explanation for that would be that we had actually a wait list for services through our options program when the pandemic began, and we no longer have a wait list for services. We've been able to use our increased funding to be able to provide service for every person who applies and is eligible for the programs that we provide.
Carol, are you still there?
Yes. I'm sorry.
Are you?
Yes.
No problem. Is that the conclusion of your remarks?
Yes. Thank you.
Excellent. And I'm wondering if I might be able to hand over the remarks as well to our other guests, too, for quick introduction. Let's see. Why don't we go with Meg next?
Sure thing. Hang on 1 second. Let me roll down. Okay. Good evening, everybody, and thank you, Congresswoman Houlihan, for inviting me to join you all tonight. On behalf of the Wolf administration, I want to thank you for your work to help pass the American Rescue Plan Act and your support to your district and our Commonwealth over the last 15 months. The support provided by Congress since the start of this crisis has allowed us to extend an incredible amount of support to individuals and families and service providers across the human services landscape in Pennsylvania to ease circumstances through this challenging year. The American Rescue Plan Act builds on this work and allows states like Pennsylvania to chart a course for our long-term recovery from the public health and economic crises we've endured throughout this pandemic. As we continue to navigate the pandemic, we know that the toll of COVID-19 extends far beyond the loss of life, long-term health impacts, and the incredible emotional strain of grief, loss, and anxiety that our society has collectively experienced. The historic unemployment, loss of income, and economic insecurity that is still challenging individuals and families in Pennsylvania every day strains resources that can jeopardize access to the things we need most, like health care, housing and shelter, food, clothing, and other essential needs. These factors and others, called the social determinants of health, can affect both physical and behavioral health outcomes, and compromising these needs to make ends meet elsewhere can greatly affect health and well-being over time. One of my agency's primary focuses over the last year has been doing what we can to help Pennsylvanians so they don't have to go without these essential needs. Congress has extended an incredible amount of support through the Supplemental Nutrition Assistance Program, or SNAP, which used to be known as food stamps. The American Rescue Plan Act extends an increase in SNAP benefits for all recipients. This gives more than 1.8 million Pennsylvanians a little more room in their food budget each month, reducing the strain on local food banks and pantries and enhancing our local economies by directly supporting our local grocery stores, food retailers, and farmers that accept SNAP. The American Rescue Plan Act also extends the Pandemic Electronic Benefit Transfer Program into the summer. This program was established last March to help fill the gap left by schools closing for families who normally receive free and reduced price school meals. Funds for this are issued similarly to SNAP benefits, meaning that this program keeps food on tables while supporting food retailers and small businesses throughout Pennsylvania. I'm very grateful to the Biden administration and Congress for granting states the authority to continue this support. The American Rescue Plan Act allocates $21.6 billion nationwide to support rental and utility assistance programs for people at risk of losing their housing or utility access. This builds on about $800 million of assistance Pennsylvania is currently working to get out through our Emergency Rental Assistance Program, or ERAP for short. Pennsylvanians can apply for ERAP, SNAP, the National School Lunch Program, and other assistance programs administered by DHS like Medicaid and the Children's Health Insurance Program online anytime at www.compass.state.pa.us. Our public assistance system exists for times that we cannot plan for and times where we need an extra hand. If you or someone you know is going through a difficult period, please let us try to help so we can recover from this pandemic together. But it's not just about recovering. The support given to states and flexibilities authorized through the American Rescue Plan Act facilitate an incredibly aspirational vision for the type of world we seek to create in the wake of this crisis. The law expands the child tax credit, targeting an unprecedented effort to reduce family and child poverty by expanding support provided to parents with children 17 or younger. Families are also able to receive advance payments of this credit throughout the year, expanding household resources. The American Rescue Plan Act also provides incredible financial support to service providers and industries that play a crucial role in the daily lives of so many Pennsylvanians and our communities and local economies more broadly. Caregiving industries like childcare and care for people with disabilities, autism, and behavioral health needs, and our aging loved ones are the cornerstone of our economy. If we're going to recover from this pandemic, we must invest in the people and providers who work every day to keep our loved ones of all ages safe and healthy, and we must be sure that those who perform this critical work are recognized, valued, and paid a living wage. The law also gives states the authority to expand postpartum full Medicaid coverage from just 60 days to an entire year after giving birth. The United States ranks last among industrialized nations in maternal mortality rates, and the Pennsylvania Perinatal Quality Collaborative's report on maternal mortality rates from 2013 to 2018 found an extremely troubling growing trend of pregnancy-related deaths, most of which occur after birth and are more common among Black women. This expansion will strengthen the interventions we can make to support maternal and infant health after birth in a way we've not been able to do before, and I'm extremely grateful to the Biden administration and Congress for recognizing the necessity and urgency for more work to reverse these trends and protect precious lives. Thank you again, Congresswoman, for allowing me to join you today and for your tireless work and advocacy on behalf of Pennsylvania.
Thank you, Meg. And again, that was Meg Snead, Acting Secretary of Pennsylvania Department of Human Services. And last but not least, Katie Katchmark, the Deputy Director of Berks Aging. Would you go ahead and give your opening remarks as well?
Absolutely. First, I'd like to thank Representative Houlihan for the opportunity to speak at this town hall today. The Berks County Area on Aging is committed to meeting the needs of seniors. So in addition to sharing the initiatives that we've undertaken and what we're looking forward to doing with the American Rescue Plan dollars, it's also very important for us to be here to hear what issues remain of concern to the constituents. So I really do appreciate this opportunity. Throughout the pandemic, we have seen a number one issue as being meals and nutritional support. And then as the pandemic has progressed, we have seen the other major need for assistance accessing vaccinations. If we all think back to March of 2020 when the pandemic was new. I know it seems really long ago, but accessing food was a really precarious task for a lot of seniors and of great concern. So our initial response included enhancing our nutritional support by providing meals going from 5 days a week to 7 days a week for our Meals on Wheels participant. And we also launched a significant effort to provide grab-and-go meals. This is one of the areas where we're very appreciative that this money is going to be extended to the American Rescue Plan, because we have overwhelmingly heard from seniors that this is an enormous need to them in this time. We're also going to be able to use this funding to further enhance our nutritional services by providing pantry boxes to seniors, which include, in addition to a variety of food, other needed household items. In January, we started shifting our resources to assist with vaccinations and providing live in-person help to connect seniors. Our staff, through working with community partners and pharmacies, directly scheduled over 2,000 seniors to receive their vaccinations. In addition to our staff helping find seniors clinics to register at, we have made a significant number of outgoing calls, and this is part of our continuing initiative. We are combing our databases, our senior center lists, our Meals on Wheels list, trying to figure out how we can get to seniors who are either hesitant or maybe just are waiting their turn, or who have not actively sought out the vaccine. So that's a big area of focus for us, is trying to get as many seniors vaccinated as possible. We're now working with the Berks County Vaccination Center to continue to help connect seniors to vaccines, and our partnership with the Berks County Health Clinic connecting seniors for in-home vaccinations. We actually had a team out today delivering in-home vaccines, and they'll be doing that again this week and in the weeks to come until we can reach every homebound senior. I also want to mention that we've continued to have a great partnership with BARDA, our area transport, providing no-cost transportation to vaccinations. We find many folks classify themselves as homebound because they don't have reliable or accessible transportation, but this partnership has allowed us to get seniors to clinics much sooner than they would have gotten the vaccine in their home. We are now beginning to focus more on social engagement, the safe reopening of our senior centers, in addition to bringing some activity boxes to our nursing home, Meals on Wheels, and personal care home residents. I think we see that although these restrictions are easing, life is not going to return to normal for anyone, and particularly for seniors who continue to be the most vulnerable. So for us, the extension or the addition of the American Rescue Plan dollars gives us the opportunity to meet whatever these evolving needs are. We know that seniors aren't going to go back to their normal way of life, and so our traditional sources of funding normally do not allow us to pivot and change, but these dollars will allow us to continue to respond in ways that I think we're not even sure yet, and be there to meet these needs as they come in. In addition, as an area agency on aging, we view one of our most vital roles as connecting seniors. Most often we are not the provider of the service, but we can be the connector to the service. So linking folks to senior centers, Meals on Wheels, nutrition programs, home and community-based programs, rental assistance, mental health services, and we look forward to continuing to be that resource. Our office is always available to help, and if I can just plug, our number is 610-478-6500, and we're also available at aging@countyofberks.com. And again, thank you, Representative Houlihan.
You're really welcome, and we'll pause right after your first couple questions to make sure people have pen and paper so they can get all the different phone numbers down. But so, when you have a chance, make sure you have pen and paper available, and we'll go through those numbers again. And with that, I have a few questions that were submitted earlier that I'll start with. But reminder to those of you who are on the phone, if you're interested in asking a question, *3 is how you can do that. My first question is to Secretary Sneed. We were talking about the importance of many of these programs and resources that are available. The Pennsylvania DHS has also developed some really nice state partnerships with our area aging, disability, and transportation services. Can you tell us a little bit more about the ways that veterans, caregivers, and seniors can continue to remain independent and in their own homes, and some of those alternatives that are available to nursing homes as well.
Absolutely. Being able to age in place and stay in homes close to families and other loved ones is something that many people want as they think about aging, but we know that sometimes they need a little extra help or support to do so safely. In January of 2020, DHS fully implemented our Community Health Choices, or CHC program, which is a managed care program for individuals who are dually eligible for Medicaid and Medicare, and for eligible individuals who are 21 or older who have physical disabilities requiring long-term services and supports. This program serves people who may be eligible for a nursing facility's level of care or could be in the future, but it's designed to give people choice, control, and access to supportive services that help them live independent, healthy lives in their home or another setting of their choice. CHC can coordinate assistive services and care, transportation when needed, and help make home adaptations to make it a safer place to live as we age and our individual needs and circumstances change. CHC served about 355,000 people statewide, and if you or a loved one thinks you may qualify or benefit from these services, I'd encourage you to visit dhs.pa.gov to learn more about the program.
And for those who have your pen and paper, dhs.pa.gov is correct?
Yes.
Perfect. And thank you very much, Secretary. The next question is for Katie. What is the number one request that you are receiving and that your office receives, and how can others who are interested in this service or others get connected with you?
So currently the number one request still continues to be around COVID vaccinations, assisting with homebound vaccinations. And then our second largest request, kind of tagging off of what Secretary Sneed said, is helping seniors gain access to home and community-based services available to them. And again, the best way to reach us is through our phone, which is 610-478-6500.
So for those with the pen and paper, 610-470, is it 6500?
I'm sorry, 478-6500.
Perfect, 478-6500. Thank you for that. And my same question to Carol, what is the number one request that you receive in Chester County, and how can people who are interested in that service get in touch with you all?
Yes, I would say in the short term past, our vaccination requests have somewhat reduced, and I would say our number one request always remains a request for in-home services. And as well, we can connect people to be assessed in order to qualify for those services and try to help them also get connected to the services that Secretary Sneed spoke about if they qualify for the Community Health Choices services. We also have a program called Person-Centered Counseling. Sometimes people have difficulty, seniors have difficulty that don't have internet access. It becomes overwhelming for them. So Person-Centered Counseling assigns one person in our office that helps, that one of the things the state allows is for us to walk that person through that application and enrollment process to help them, say, do you have all these verifications available, that type of thing. So that's been an invaluable service, especially during this pandemic when we cannot actually see people haven't been able to see people in person for most of the time. I would say our second most requested issue right now would be housing related. And as Katie talked about, we don't, have those resources available directly through us, but we certainly try to link people with every available resource in our county and try to be as knowledgeable as we can, down to the fact that sometimes we have to refer people to the 211 United Way line because we have seen a drastic increase in homelessness in seniors. And if people need any assistance at all from Chester County, they are welcome to call 610-344-6350. If it is someone that has internet access, you can also apply for services or gain information online at Chesco, chesco.org/aging.
Okay, so to repeat that, 610-344-6350. 344-6350.
Yes.
And for those with the internet, Chesco, chesco.org/aging is how they can get that for Chester County residents. Excellent.
Yes.
And thank you, ladies, for these questions. I think what we'll do now is turn it back over to Connor, who will start with the questions from our dial-in audience.
Thank you, Chrissy. And our first question today comes from Elizabeth. Elizabeth, you should now be on the line.
Hi, Christy. I was just asking about, you were talking about how 70% of seniors have received the vaccine, but we are trying to reach a threshold of 70%. So where are we short? Does this include vaccinating 70% of children? I'm just curious what gets us to that threshold to stop the requirement for masking.
Perfect. Thank you, Elizabeth, for your question. I'm going to hand that over to Director Sneed, but also I wanted to add there are a few questions here, Director, about the CDC guidance versus the state guidance regarding masking. So if you could speak to that a little bit too.
Connor, were you talking
on the line?
This is Meg. Yeah, I'm sorry. I'm sorry, you threw me off with the title. Elizabeth, do you mind restating the question? I'm happy to attempt to answer it.
It has to do with masking and the requirement to continue to mask. And it was stated that we are looking to get to a 70% threshold, but we were also told that 70% of seniors are already vaccinated. So who else are we trying to vaccinate to get to this 70% threshold? Is it including even very young children? Are you looking for every age group 70%? I'm just curious.
So it's a little bit outside of my lane because the Department of Health really is the liaison for the department on vaccine-related issues. But I think when we're talking about 70%, it's 70% of eligible Americans. So we're looking at, the Pfizer vaccine was just made available on emergency approval for kids between 12 and 15, and I think that broadens the group that we're working with to try and get collectively to a 70%. And hopefully as approvals come down the line for additional age groups, that helps us get there at a faster clip.
And if I could add in there too, I think it's a good question and one that I also asked, when this guidance came out. And my understanding that came back to me was that it was the 70% of eligible people for the vaccine in Pennsylvania. And I think your point is a good one, which is that we've almost immediately expanded the opportunity for kids as well. Not all children, but many who are, kind of tweens and teens. And now we have an opportunity to get to that population as well. And I would definitely encourage, anybody who has a kid in that age group to avail themselves of the vaccine if they're able to. And this is one of those things that I know is kind of a really evolving, literally by the day and by the hour, process and procedure for each state and some communities. I know that some communities within Pennsylvania also are maintaining their mask requirements despite differences as well. So I know it's terribly confusing. Trust me, it's confusing here as well. But I think that we're just trying to keep up with the science, we're also trying to make sure that one of our best tools in our quiver is to get everybody that can be vaccinated. So please encourage people to continue to get those vaccines. And thank you so much for the question.
Thank you, Elizabeth. Our next question, looks like we lost that call. Up here she is. All right, our next question comes from Doris. Doris, you should now be on the line.
Hello, thank you, Christy, for the information, the vital information you've given today. I would like to know if you have a date for the opening of the senior centers here in Westchester.
All right, thank you. I think I'll toss it over to Carol.
Yeah, my understanding is that we do not have a definite date. I can tell you that it is coming very soon, that there are serious discussions that are happening this week about it, but I wish that I could give you an absolute date, but I know people are very anxious, but it is really coming soon.
And maybe what we can do is take that, really terribly reasonable question and see if we might be able, through our mailing, email and other mailing outlets, to be able to provide that information when it becomes available. We really try to keep our website and our email list really updated on these kinds of issues. So if there's things like that that's come out of this call or other questions from this call that we can let people know about as they become open, we will try to do that through our communication network too.
Thank you so much. And we have a few questions on the line, so I figured I'd ask because we've got about 3 or 4 specifically regarding if I don't have internet access, what are the best numbers for me to call regarding vaccine appointments or support in this space. So if we could just go down the list for our Chester and Berks representatives really quickly, and if you wouldn't mind just repeating those phone numbers, best points of contact for our seniors in the community. So Katie, why don't I start with you?
Sure. Our office number is 610-478-6500.
Thank you so much, Katie. And Carol, could we get the same for you as well?
Yes, absolutely. Our office number is 610-344-6350.
Got it. Thank you both so much. And we will also include those numbers in our newsletter. Our next caller today is, excuse me, y'all, Leanne. So 1 second, Leanne. Having a technical issue here. Leanne, you should now be live on the line.
Hi, my name is Leanne. I'm from Leanne's Life Changing Fairy Group. I am a nonprofit that helps with the homeless and people that are in need. Are you hearing me?
Yep.
Okay.
We're here.
Okay. A few questions that I had was, as far as the vaccine, I work with a lot of people on a daily basis that can't get to a site. They're homeless. They want the vaccine. They don't drive. I have a few veterans. Is there something out there that I could put them through that they could get a shot, maybe come to them? The funds for housing is my other question. They've tried to get help. There's one lady that literally has COVID that's sleeping in a car. Can't find any help for her at all.
So if it's okay, maybe what I'll do is I'll take the second part of the question about housing and rental assistance. And also in the case of this particular person that you're talking about, if it's all right, I'll have a member of our team give you a call after the town hall tomorrow to try to, get specifics to the degree that we're able to about this particular case. But the thing that's good about the American Rescue Plan is that there was quite a bit of resources, about $670 million in emergency rental assistance. And the ways that you can or a person can apply for rental assistance are through the Pennsylvania Department of Human Services website. And so I'll have Meg, if it's okay, talk a little bit about the DHS and the opportunities there. But again, please do make sure that our team gets your contact information. And then perhaps, Connor, we can find, I know that there are availabilities of for Chester and Berks to have drive-up kind of vaccination sites, and perhaps our other guests, Katie and Carol, can help us with that.
This is Meg. I'm happy that as it relates to the emergency rental assistance program that is currently being run out of DHS for the majority of counties in the state. So I would encourage you to visit our website. It's www.dhs.pa.gov/ERAP, ERAP as in Pam. that you should be able to apply directly. We are going to really be aggressively turning our attention to the Emergency Rental Assistance Program. There's an enormous need across the state that we recognize, and we have the resources to be able to address it. So we will be going out on the road over the course of the next couple months and really working hard to get these dollars into the hands of people who need it. But any local service provider, particularly the county, and certainly through the DHS website, should be able to connect you directly to the ERAP program and the millions of dollars that we have available there to help people.
And for Katie or Carol, are there any sorts of resources for these particular folks who are not necessarily attached to an address that we might be able to help them with?
Sure.
If someone absolutely, sure.
Sorry, it's Katie in Berks County. So in addition to contacting our office, the Berks Cares Center, which is our vaccination center, they have done a really wonderful job of knowing what all the resources are. So their vaccinations just don't happen at their physical building. They are aware of all the providers throughout the county, the different initiatives through the providers to get out to homeless shelters, the hospitals, street program, and their number is 888-712-2772. And they have a great understanding of everything that's happening in the county as far as vaccinations.
Can you give that number again?
This is Meg. Can I just, oh yeah, please, go ahead.
888-712-2772.
Thank you.
This is Meg. I just wanted to add one thing about rental assistance. The dollars can be used to rehouse people, so it's not specifically for those who are at risk of homelessness, but can be used for people who are experiencing homelessness. So I would encourage you to contact the department, and we can come up with a plan for, connecting more people in the homeless assistance system directly to that rental assistance. Be happy to have that conversation, but I just wanted to clarify that the funds are relatively flexible, and we're really grateful for that, so we can try and tackle the population that's experiencing homelessness as well.
Thank you. Connor, do we have
yes, and I could address in
Nope,
Chester County in terms of the vaccine availability. Certainly, if someone's a senior, contact our department, but also if they're not 60 and above, the Chester County Health Department would be in charge of trying to connect people with whatever resource. And we can actually have EMTs go to someone that cannot get to a site. There are sites all over the county, but there is a team at this point of EMTs that are going out to give homebound vaccines. And the number for the Chester County Health Department would be 610-344-6225.
Thank you. Connor, do we have another question?
We do. We have time for one more question. I still see that there are more people in the queue, so please, if you have questions, continue to press *3. Our policy in Chrissy's office is always that within 48 business hours, a member of Chrissy's staff will get back to you with an answer to your question. So again, if we weren't able to get to your question today, please know that a member of Chrissy's staff will reach out to you within the next 48 business hours to touch base with you and see if we can help you out. All right, our last question today comes from Karen in Coatesville. Karen, you should now be on the line. Karen, are you there? Karen, is that you?
Yes.
Yes, do you have a question?
Yeah, a couple of things. One, Chester County was wonderful. I fell and broke my neck and came home and could not get back to get my second Fauci, as I call them. And Chester County was so kind to come to my home and give me my second vaccination, and I was so happy with that. But what I'm concerned about is I got an email today, and it looked real, it looked IRS, all this, about an extra $878 a month, and you go click this link. I didn't do it, but and it's aimed at elderly, and I'm afraid that it's going to get some people in trouble. And I just wanted to ask the Congresswoman, is this real or is this bogus?
And thank you, Karen, for the question. And what I would say is that there is not an additional check at this time, unless you are referring to the stimulus checks that we have passed, and that does not align with what this email sounds like. This does really bring up a very, very important question about scams that are sadly trying to take advantage of us, particularly our elderly, at this very difficult time. New data from the FTC, or the Federal Trade Commission, says that in 2020 alone, there were 4.7 million reports of scams, which is a huge increase of about 1.5 million from the previous year. So most of that increase is actually directly due to COVID scams, because scammers see an opportunity and they're trying to prey on people with these fears. So in fact, we did have, I think it was a couple months ago, a town hall with Attorney General Josh Shapiro on this issue of scams. And so if you feel like that you are a victim of a scam, or you think that you know of one that you're just trying to help report, you can contact the Attorney General's office, and I know that he's quite good at rooting these out and tracking them down. The email that you can contact their office at is 717-787-3391. But I do think that Karen's instinct to not click on any link that is soliciting you to provide information, or that seems like it's too good to be true, my advice is always to try and do some research on your own to find the number for the organization that the email purports to come from, and to call them and ask them if this email indeed came from them. So that is, I believe, our last question, Connor. Is that true?
That's true. Yes, Chrissy.
Okay. Well, I really want to say thank you so much to our panelists. They are very gracious to have provided their time on a Tuesday evening to us. I also want to very much thank our community, the constituents of the 6th Congressional District, for listening into this town hall. We've had lots of people in the thousands on the line, and we're grateful to you for hanging in there and listening. We will be able to provide this tape to you as well through our newsletter and many of the phone numbers as well. So thank you so much once again for joining us. A reminder that if we were not able to get to your call, we'll follow up within 48 hours with a call from my team. We'll go ahead and also post that on this call on our website. And our website, for those who have internet access, is houlihan.house.gov. And I'll say that slowly because my last name is spelled somewhat strangely. It's HOULAHAN. Again, HOULAHAN.house and .gov. And importantly, I need you to subscribe to those newsletters so that I can reach out to you with this kind of information. So please go ahead and click on that link so that you can get frequent updates of what is going on in our community. As always, our office belongs to you, our community. In fact, I'm pleased to say that some of our offices have begun to be able to be open more regularly, and hopefully that will become a more regular occurrence. If you have any questions, please do feel free to reach out to us by phone. And our phone number is 202-225-4315. Again, that number is 202-225-4315. It goes without saying that it's an enormous privilege to serve this community, particularly at this very difficult time. Thank you so much for joining us this evening, and please stay safe.